All right. Welcome to the deep dive, everyone. Today, we're going to be tackling something that sounds kind of technical, maybe even a little bit boring.
Yeah.
Clinical care pathways, but
Yeah.
stick with us. I promise it's way more interesting than it sounds.
Definitely.
These pathways, they're like personalized roadmaps for your health,
Exactly.
guiding you through every step of a treatment or condition.
Mm-hmm.
So whether you're actually going through something, dealing with the healthcare system yourself,
Yeah.
or you're just interested in how modern medicine works,
Absolutely.
this deep dive is going to be full of aha moments, I promise.
Definitely. It's kind of like this.
So let's get into it.
It brings together like the best of both worlds.
Yeah.
The efficiency of having something standardized,
Okay.
but also the personalization
Yeah.
of actually caring for the individual.
That's fascinating. So clinical care pathways, in the simplest terms, what are we even talking about here?
So think about it like it's a detailed roadmap
Okay.
for a specific medical condition or treatment. So for example, let's say you're dealing with diabetes.
Okay.
A clinical care pathway for diabetes would outline
Right.
everything, really, from the diagnosis to how you're managing your medication,
Mm-hmm.
lifestyle changes, ongoing monitoring,
Yeah.
all based on the latest medical evidence.
So this isn't just about treating like the problem at hand.
No.
It's about like long-term health, creating that plan.
Exactly.
Yeah, that's amazing. And it's not just like someone's best guess at what might work, right?
No. This is all built on an evidence-based framework,
Okay.
meaning they draw from like all the latest research and best practices
Okay.
to make sure you're getting the most effective care.
So you can feel good knowing that there's something solid behind this.
Definitely.
But, you mentioned personalization,
Yes.
and this kind of sounds like a one-size-fits-all approach.
I could see why you would think that.
How do they actually make sure it really is tailored to the individual?
So this is where you get a whole team of healthcare professionals involved. Doctors, nurses, pharmacists, dietitians, everybody.
Wow.
They all work together to tailor that pathway to your specific situation.
So it's like having a whole team in your corner,
Exactly.
making sure you're getting the right care.
Absolutely.
But I mean, coordinating all these people, that has to be complex, right?
It can be, yeah.
How do they actually make it work in a practical sense?
So one of the key things here is standardization.
Okay.
By outlining clear steps for, diagnosis, treatment, follow-up,
Right.
it minimizes variations in care, so it's like a tried and tested recipe.
I like that analogy.
It's going to bring a delicious outcome, but with room for adjustments based on individual preferences.
Yeah, because everyone's taste is a little bit different.
Exactly.
But, with all this focus on standardization,
Yeah.
are there ever any concerns that maybe some unique needs get overlooked?
That's a great question and a valid concern.
Yeah.
The key is finding that right balance, And these pathways are made to be adaptable, and that's where that patient-centered approach really comes in.
So how do they ensure that the patient's voice is actually heard?
It's about empowering the patient to be a part of their healthcare journey.
Yeah.
It's not just, passively receiving whatever is happening to you.
Right.
You're involved in decisions every step of the way.
And that ownership probably makes you feel a lot better about the whole thing.
It really does.
But besides just, feeling better,
Yeah.
are there any tangible benefits?
Oh, absolutely. Studies have shown that these pathways can lead to faster recovery times, fewer complications.
Wow.
For example, research on diabetes management pathways found that patients who follow a structured pathway were 40% more likely to achieve their target blood sugar levels.
That's huge.
It really is.
And I imagine that this probably helps with, healthcare costs as well.
Absolutely. It streamlines things. It reduces the need for, extra tests that aren't necessary, which then translates to cost savings both for the individual and the healthcare system.
So it's like a win-win situation all around.
It really is.
Now, our sources go into some really interesting examples of these pathways.
Oh, yeah, there's some fascinating stuff.
I was really intrigued by the acute myocardial infarction pathway.
Oh, that's a great one. Heart attack, right?
Yeah, the serious situation.
Every second counts.
Yeah.
This pathway makes sure that everything from the moment you're diagnosed to the treatment is done as efficiently as possible.
So it's like you've got this well-rehearsed team.
It is.
Everyone knows their part and when to jump in.
Absolutely. And it's not just for emergencies.
Okay.
Like the surgical recovery pathway, for instance.
Yeah.
It makes sure your whole surgical journey from before to after is optimized for a smooth and fast recovery.
So, to sum it up,
Yeah.
clinical care pathways, They're making healthcare better.
They are.
They're making it more efficient, more evidence-based,
Mm-hmm.
more patient-centered.
Absolutely.
But it's still evolving.
Definitely. As we go forward, we need to keep thinking about how to best adapt these pathways to serve everyone, to make sure everybody gets the best quality care.
That's a really important thing to remember.
It is.
And as these pathways keep changing, we'll be here to explore it all.
Absolutely.
Thanks for joining us for the deep dive.
Thanks, everyone.